Hey, we're spending a few minutes from Southern Smiles of Sylacauga, Dr. Rick Redmond and his wife, who is the patient care coordinator, Joni Redmond. Good morning to both of you. Good to have you with us today.
Thank you for having us.
Hey, we got some exciting news from the last time we talked about the IV sedation.
Yes.
And so let's talk a little bit about that. But first, let's talk a little bit about what we're going to be sharing this morning on Daybreak about the mini implants, but you do a whole lot more than just mini implants, Doctor.
Yes. The first thing I wanted to talk about was the new service we've added, the IV sedation. Of course, we've got laughing gas, and we've been able to give folks a little pill, but there are a lot of patients who that's just not enough.
Mm-hmm.
So now we can basically put them to sleep. It's not like being in the operating room, but it's where folks are off in la-la land, and the medication makes it where you normally don't remember.
Yeah. And what, you started this in January, is that right?
Yes. We just, it's been a process to get the permit from the State Dental Board, but we finally finished all that.
The first patient was a lady.
Yes.
And kind of walk us through that process, because we've got people watching and say, man, you know, I need to see them, but I need to know how this stuff works.
Well, like Dr. Emmons said, it was a process. He started last March. He took the class, and he had already been studying a lot of studies and everything, and there's so many books that he has to go by. It's just like when you're in surgery on a body part. Mm-hmm. And so he took the office to Kentucky and had the girls to train with him. And then it just took this long to get it, and I'm just so thankful he could get it. But the lady, I've known this lady a long time, really sweet lady, really kind, and he gave her some medicine the night before to take in the morning.
Was she skittish like I would be?
Yes, sir.
Yeah. Okay.
Yes, sir. Very, very. It was like you had to push her to get her in the door, just to come for a visit to talk. And so anyway, she came in the next morning, and she was just, she was herself, but she was so calm, and a lot of us need that medication, speaking for myself. And she sat down, and she's usually afraid of the needles, you know, she said, but she was just, I guess, la-la land. And she said that she don't really remember any of that, but she was, once he got the IV started, she was in and out. And they could ask her if she was okay, if she felt anything. She could answer, and even if she needed to take a break, if she needed the restroom, she was able to get up and walk to the restroom and come back. So it's not like when you're having I don't know what you would call it, a more detailed surgery, like
in the operating room.
Operating room,
they're having to breathe for you.
Yeah, they're having to breathe for you. That's exactly right, in the operating room. But she, and we called her the next day, and she was excellent. And what he did on her in 3 hours, if she had not have had that, it would have took at least 5.
Wow. What services did you provide for her that day?
Oh goodness, we did a crown, we did 3 or 4 fillings, and took 2 teeth out.
Yeah.
So.
Yeah. And too, when you talk about the IV sedation, whether you're young or not so young, everybody handles. Now, used to, I wouldn't go in the city block of a dentist. You know, it's just sometimes you have effects from a prior dentist down years ago and stuff like that. And this is something that everybody can have a fair playing field, and they feel comfortable coming in.
Right.
Yes, and with the medication that we use, it's like this lady took more than I would have thought, but you just give a little bit more, wait 5 minutes, see how if that did it or not. If not, give a little bit more, and then, it works for about an hour. So about an hour later, I could tell she was kind of coming back around. So I just gave her a little bit more.
And I want to add something right there. I've worked beside him over 25 years, and sometimes, like when a person is going into surgery, they're saying, now I'm sensitive to medications, I'm not able to handle this and this and this, and the anesthesiologist really doesn't listen. I've been there. But he is so genuine, like he starts, myself and his assistants, like, just go on and do it, but he's just very easy going and works up to it. He's genuine on that, really.
Well, everybody's body's different, and from day to day, your tolerance is different too. So you just have to titrate it.
And so with the IV sedation, you're able to do a lot of different provide a lot of different services at one time.
Yes.
Where it would take you 2 to 3 months maybe to get different time set to do the work that's needed.
Yeah, you're exactly right on that, because like we would have had to get her back for the extractions because her mouth would have been tired from holding open from the crown, or the opposite. We'd have had to get her back for the fillings, so you could just knock a lot of stuff out at one time.
Before we go too much further, we want to talk just a second about Southern Smiles of Sylacauga. That's who we are now.
Yes. We, it's always, I've been practicing here almost 30 years, which is hard to believe, but it's now that Dr. Casey has joined the practice, and I tell patients, because I get asked, 2 things. One, we haven't sold out or anything like that, but I can see a time when, probably when I reach my early 60s, which I've got about 5 years before I do that, I'll probably want to slow down. And so if I slow down a little bit, there's a chance we might even need to have another dentist come in. So anyway, just keep adding more names to it. Wasn't very, we didn't feel like that'd be better.
What was the initial thought of the IV sedation as far as many implants are concerned?
That, because so many patients are, they just can't, it's hard for them to wrap their head around the fact that you're going to put basically a titanium screw in their jaw, and it's not going to hurt because you get them numb. Some patients are harder to get numb, and some are easier. But in general, and there's not a lot of pain afterwards. But everybody's so afraid.
It's the mental aspect.
Yes, they're so afraid that when you're doing that, it's just going to be killing them. So.
And probably like right now, somebody's saying, "Oh, well, he probably has never had it done." I've had it done. And it's exactly like he said. I mean, I had a tooth that just split, and so you can't glue it back together. So he took the tooth out and placed the implant, and the only thing that bothered me was the injections, just the soreness of that.
Now, on the desk this morning, you've got dentures, and comparing dentures to implants.
Yes. We've got, like we talked about the last time we were fortunate for you to have us on, so many people have dentures for one reason or another. I mean, it's part of life. And most folks hate the lower denture because there's nothing for it to get suction or hold on to. So yes, these mini dental implants are wonderful, where you can put those in there and that snaps in, and you can see it just doesn't. It's going to hold it in place.
Just say that I needed bottoms, okay?
Yes.
And I may need that one day. But comparing time to implement a plan for the mini implants, can you do that all in one day?
Just this week I had a gentleman, and it's not my typical patient, but he's 90 years old, and he's had dentures forever. And I tell folks, trust me, I'm not a salesperson. I mean, folks will come in with a problem, and I say, look, this is what we can do. But so his lower denture was fine. So we took the CT on him that we've got at the office. He had plenty of bone. So he came in, I got those implants in one visit, and his bone was dense enough where the implants were very stable. So I got them snapping in to his lower denture. So he left with that snapped into place.
Wow, 90 years old.
90 years old.
A kid could be involved in a baseball or football accident, or you could be in an automobile accident like one of the commercials talks about.
And we've seen that, yes, sir.
Yeah.
And really, just in the last month, I had a gentleman who's, he's around 30, and for some different reasons, he's wearing dentures, and the bottom one just drives him crazy for that same reason. So we So like you said, the age doesn't matter.
It can be so embarrassing.
Yes.
Well, a lot of times it floats.
Yeah.
It's just like it floats around and then your food wallers around.
And that was a big issue for him.
Yeah, no doubt about it. Hey, we're talking with Dr. Rick Redmond and his wife, Joni Redmond. They're at Southern Smiles of Sylacauga. We've just begun the IV sedation for those of you like me who may be a little skittish. And I'm sitting close to them this morning, so I feel better about it.
I'm going to reel you in before it's over.
But you know, when you talk about dental hygiene, and you talk about people who, whether they're young or not so young, need your service, you got to make them feel at home. You got to make them feel like that you really care about them.
And that's one of our, I would say, one of our strong suits.
It is.
I've always felt extra pressure being in a small town to treat people right, because you know you're going to see these folks at church or the grocery store. I mean, myself, of course, my wife and Dr. Casey, we all live here also. So, yes, I feel like it definitely comes back to you if you don't treat people like family.
One of the things that people are going to ask, this has got to be costly. Does insurance or does Medicare or anything else help me with that?
That's a good question.
That is a good question, and dental work in general is expensive, but this is, compared to traditional implants, it is about half the price of traditional implants.
That's fantastic. So we're talking with Dr. Rick Redmond and his wife, Joni Redmond. Joni is the patient care coordinator, and Dr. Redmond, how long have you had this business now?
Like I said, it's hard to believe this summer will be 30
29 years of age in July.
Wow. And you just had your ribbon cutting and grand opening not long ago too.
Well, that was for the rebranding, the new name.
Yeah.
So we're just excited that we've got another hometown person, Dr. Casey, to join us here.
Speak to people this morning, and they may not be from Sylacauga, they may be from Montgomery, they may be from Huntsville, they may be from Gadsden, whatever the case may be. Speak to people who are right at the edge of saying, "Hey, I'm going to contact these people."
I will tell you, it really has amazed me that we've had patients come from up above Huntsville and even down from Mobile that were looking for something. They had enough bone for these implants, but they didn't have enough for traditional implants. So they were going to have to go through a huge grafting procedure, sinus lifts and everything like that. And both of them have had dentures for a while, and they didn't want anything that came in and out. So they both have traveled quite a bit to get a porcelain bridge that will stay in there. So yes, it is amazing. But folks can call the office and we'll set them up for a consult. We don't charge for that, just to see if you're a candidate to have this done.
And Joni, people like me, you know, we're funny. We don't want people to read our mail. We don't want people knowing why I'm in Dr. Redmond's office. You know, and it's so important that you have that type of relationship with them that they can trust you.
And we do. And we have also, when the office was built, we made it a home atmosphere. There's so many people that come in and say, "Oh, this place is so homey," and I'm like, "Just wait till you meet the employees." Yeah. And then when we do something that's like, we do Botox, we offer Botox in the office and other things to beautify ourselves. And we have a different door to go out in case you don't want to go back out front and somebody may be in the waiting room or somewhere, and so it is private also.
And we did have a lady just recently within the last month that was very concerned about that. So Morgan, who was here last time, you know, she brought her into the office. The lady was wanting implants, took the CT, and then took her back to Morgan. Morgan took her back to her office. So, I mean, and I just went in there to talk to her after I looked at the CT. So,
fantastic.
Yes, we can handle that. We got plenty of space and rooms.
For your dental care needs, ladies and gentlemen, whether you're young or not so young. You may be like the 90-year-old, or you may be a young kid that's had your teeth realigned from a football injury or a baseball injury, and you need mini implants. We can take care of it. And Dr. Redmond, I know you want to personally invite them to give you guys a ring or set up an appointment.
Yes, we'd love to have you come in
Yes, we
and
would.
take a look, and like I said, see if you're a candidate.
All right. Thank you both for coming today.
Hey, thank
you.
you so
And,
much
we-
for having us.
Oh yeah, we enjoyed having you. And IV Sedation, you want to ask about this at Southern Smiles
That's right.
of Sylacauga. We've got more Daybreak coming up right after this.